Well, hello there, friends and family. This is Crazy Kathy, aka Paranoid Kathy, coming to you live with another rant slash venting session slash public service announcement about the new coronavirus, aka Covid19, coming to a neighborhood near you. So first of all, thank you so much for those of you who took the time to PM me after my last public service announcement, which I didn't even think anybody would read it or care to hear what I had to say about it. I'm glad some of you guys who had never heard about it before actually found it helpful. I am doing this because I am finding that 99% of the people around me in my everyday life either don't know what's going on with it, or they just don't give a flying fuck. Okay, and what really concerns me is that most of the people I'm talking about are people in the medical field. We are going to be the first responders when, not if, this hits us. And I don't know if you guys already know this. Federal and state government officials decided that they would be moving people who tested positive for the new coronavirus, or COVID-19, from the Air Force Base where they are right now up north to a residential neighborhood about 30 minutes away from where I live. They were going to house them in a 60-year-old dilapidated residential building that used to house people with disabilities. It is not being used anymore, and they were considering using it as a homeless shelter, but found out that it was not even suitable for that. And yet it is suitable to place these people with a virus we have no vaccine or knowledge of in a rundown building in a residential community. I'm sorry, I'm just laughing because it's so ridiculous. Fortunately, the city filed a restraining order and a lawsuit against the United States government, the Air Force, CDC, and all those organizations, just to prevent this from happening. So the judge has temporarily agreed for them not to move just yet until the public is informed. They want to make sure that the hospitals are ready. They're going to dump them there without knowing if the hospital staff nearby is ready to take care of these people. We are not ready. That was supposed to happen today. The city was told about it on Thursday, and they filed a lawsuit and a restraining order on Friday. That's how much time they gave them. I am also very concerned because the hospitals are only preparing according to what the CDC guidelines are and what the CDC recommends. I checked the CDC website this morning, and it looks like it hasn't been updated since the first week of January or so, when the rest of the world heard about this virus. And it says that it's transmissible by droplets only, when there are 25 to 27 other countries that have outbreaks, and those countries are pretty much saying that it is transmissible by air, that it is airborne, by droplets. It lives on surfaces for some say, I think, over 9 days approximately. And now they're saying the fecal oral route. I have been a nurse since 2008, and I have never touched or never worn one of those hazmat, whatever the fuck you call those spaceship astronaut suits that you see on TV. The ones that the healthcare workers wear when they're taking care of these people with the illness they have no idea about. Yeah, that. I anticipate practicing wearing that when I first come in contact with my first patient. That's how prepared we are. I can barely wear an N95 mask. By the way, the hospitals are locking up masks now because people are stealing them, I guess. And there's already a shortage. We don't even have an outbreak yet in America, and we already have a shortage. Just some food for thought. And we don't have enough testing kits. They actually wanted to have 3 of the largest cities in America Los Angeles was one of them, start testing people with flu symptoms. But the COVID-19 testing kits that they sent were defective. So we really don't know who's wandering around with the virus. Yeah, I'm not quite sure what the CDC is waiting for, or if they just don't want to cause panic and just want to wait until people are dropping dead like flies like they were in Wuhan before they start declaring anything and preparing us. But oh, and I just found this out 2 days ago. I started reading articles. Do you know that there are about 70,000 people, 70,000 up in Northern California around the San Francisco area that they are monitoring and asking to self-isolate. I don't believe they've tested them just because, yeah, like we don't have enough testing kits. And according to the CDC, we only test people who came from China recently and who are displaying symptoms, even though people are getting the virus from people who are not showing symptoms. Yeah, like the lady in South Korea who went to church and yeah, like the sweet little old lady who went to church in South Korea who spread the virus to about 46 other people. She was a superior spreader. A+. Okay, just one more fun fact. I can ramble about this all day and night only because I've been so obsessed with educating myself about this, because it's going to affect me directly and my family and you guys, whether you want to believe it or not. I just read today that the Chinese government had a little last minute powwow, little meeting, because they are planning to extend the time frame of the quarantine. It was initially 2 weeks, but now they are finding out that people who were quarantined for 2 weeks, who were infected with the virus and then got better, are getting reinfected. So now they want to place another extra 2 weeks on top of the 2-week quarantine, if that makes any sense. Meanwhile, America is letting the people who were quarantined for 2 weeks go back to their homes and move on with their lives just because they've met the 2-week quarantine time period without retesting them. Yep. And they're telling the public that they are 100% not contagious, which is a very bold statement because we're obviously finding out now, hi, thanks China, that this may not be the case. There was a man, God, I forgot what country it was in. China? Korea? Japan? I don't know, it's everywhere now. Who basically started showing symptoms after 27 days. I don't know, maybe he was a fluke. Oopsie! One more fun fact. You guys already know about the group of Americans who have been flown back to the United States against the CDC wishes, and President Trump is furious about it because they were not supposed to be here so soon, and they were mixed in a plane with healthy people. Yeah. Okay, so what is my point in all of this rambling? Number one, educate yourself because the government won't do that for you. I have personally gotten a lot of my information about the virus from news sources from other countries, such as Singapore, South Korea, Japan, the UK, India, Turkey, just anywhere aside from the United States, because we are pretty slow in getting the facts out. And my other point, aside from making sure you educate yourself, is to make sure that you prepare yourself. Not panic, just prepare. Because, okay, and this is just my personal opinion, as a nurse for 12 years, and my knowledge of the healthcare system and what's going on with this virus, how quickly it's spreading, we're not ready for it. We don't have the manpower, the resources. We don't know really much about this virus. We're just guessing right now, as they call it, shadow boxing. We don't know how long this is going to last. Our only way of preventing the spread is by quarantining people, and obviously we're not doing a very good job at it because we've got 10 cities in Italy on lockdown and most of South Korea on lockdown, and it's just kind of getting control. We've got how many deaths now in Iran and the Middle East? Damn, that was long. Okay, and that was just a summary from the last 4 days. Okay, I hope that was helpful. Good luck. Also, my apologies for this very crappy look. I'm still in my scrubs. I've worked 2 shifts back to back, graveyard, and I've only slept 4 hours in the past 56 hours, but I'm still functional.